It is that time of year again. Virus season, with a hint of allergy season thrown in if you live in the south. Flu season has been deadly this time around, and I am not sure that it has peaked because it typically runs until March or April. There is still time to get a flu vaccine, the primary way to help prevent getting the flu, although the ideal time to get vaccinated is in September or October, before the flu season begins. Reports indicate that this season's vaccines do not completely protect against the flu strain causing current illnesses. However, getting the vaccine allows the body to build up antibodies, which will help keep people from getting as severely ill as they would without it. My college anatomy professor compared it to training dogs to hunt. When these dogs spot the germs they have been trained to recognize, they spring into action to eliminate them. COVID, flu, and RSV are the respiratory viruses that currently have vaccines to treat them. But when enough people do not get the vaccine, the outbreaks tend to be worse. There are other viruses, over 200 types of cold viruses in fact, including the corona, rhinoviruses, adenoviruses, and human parainfluenza viruses, which do not have a vaccine to prevent them. RSV is the only cold type of virus that has a preventative vaccine available. However, it is currently only given to vulnerable populations including immunocompromised children, people with chronic illnesses, and people 75 years and older ages through prescription. Usually, when people die after contracting a viral illness, it is due to complications such as pneumonia or overwhelming sepsis, not the infection itself. The way viral infections work is there must be exposure, through people coughing, talking, singing, expelling their germs into the air. Some fall to the ground quickly, but others, like the COVID virus, can linger in the air for hours, allowing people who enter a room after the infected person to be exposed as they breathe in or ingest the virus by putting hands on a contaminated surface, and then to faces or mouths in the case of children. Our bodies mount a defense, trying to contain or expel the germs. The nasal tissue swells and creates extra fluid, which flows from the nose and drips down the back of the throat. The drainage in the back of the throat stimulates the cough reflex and can also irritate the vocal cords, causing swelling and hoarseness. You might say, there is an allergic reaction going on. Getting evaluated within 24 to 48 hours after one starts to feel sick helps in getting treated in a timely manner. The window for effective treatment for the flu is 48 hours or 2 days, and for COVID, 5 days. The antiviral medications are by prescription only, and they do not prevent or dry up secretions. For all viral illnesses, the treatment includes rest, antihistamines to help dry up the secretions and decrease the A reaction, which cause swelling and congestion, making it easier to breathe and stop coughing. Lots of fluids help flush the allergens out of the system, decrease fevers, and generally help with feeling better. Take supplements like vitamin C to help boost the immune system. It is a water-soluble vitamin, meaning that every time you pee, you will pee it out. Take vitamin C daily during the fall and winter months. If you want to get it naturally, eat citrus fruits like oranges, tangerines, strawberries, and drink lemon or limeade sweetened with honey. Honey will help to soothe coughs. Remember to never give any child under 1 year of age honey, as it can cause them to become extremely sick with botulism poisoning. If you are diabetic, honey is also off the table, as it will make your blood glucose run high. There are supplements like Emergency and Airborne that also help boost the immune system. Pay attention to the age limits because some restrict children younger than 12 to 14 years old from taking them. For younger children, use fruit or plain vitamin C. Take medications such as acetaminophen and ibuprofen, take after eating, to help with body aches and to bring down fevers. Please do not give children aspirin for fevers. At the very least, it can make them sick, and the very worst, it can kill them due to an illness called Reyes syndrome. If you take an antihistamine and days later, usually 3 days, you still have secretions and a constant cough, it is not working. You need to add a second one. For any individual who is having trouble breathing, with ribcage sucking in, bluish-looking lips, and nail beds, pale or greyish colour, flaring nostrils, are young children or over 50 years old with these symptoms, you need medical attention right away. No matter how long it has lasted, even for hours, go to the emergency room now. If it has not progressed that far, but chest feels tight with a constant cough, get to the PCP or urgent care. You need stronger medications than antihistamines. Steroids will block the reaction and decrease the swelling, congestion, and drainage. Breathing treatments like albuterol will relax the respiratory muscles, open the airway, and allow air to go in and out more easily. If it has been going on for longer than 10 days, there may also be a need for antibiotics due to infections in ears, sinuses, upper airways, and lungs, pneumonia. Understand, though, that a viral infection by itself, or bronchitis, inflamed, swollen airways, does not need antibiotics. In fact, they can cause more harm than good, as they expose germs to antibiotics. This allows the germs to change their DNA, making it harder to treat infections when antibiotics are necessary. Superbugs are created through this process. Allergies cause the body to react in a similar fashion to viral illnesses, in terms of congestion, drainage, and cough. However, they will not cause body aches, fatigue, and fevers. That is one way to help differentiate a viral illness from allergies. Allergies also usually begin with sneezing, itchy eyes, ears, or throats. The treatment is also antihistamines because, and here is another similarity, not drying up the drainage will lead to infections as mentioned before. The nose, ears, and the back of the throat are all connected. There is naturally occurring bacteria in those areas, which are also dark and warm. When there is also a large amount of moisture, it becomes the perfect environment for bacteria to grow and cause infections. Basic ways to protect yourself and others from getting sick are hand washing. Hand washing, hand washing. Did I mention hand washing? Wash hands for at least 22 seconds with soap and water, or use hand sanitizer with at least 70% alcohol content. Cover your mouth using your arm or elbow when coughing or sneezing. Wear a mask, especially if you are immunocompromised. Stay home and keep your children home if you are all sick. I know that it is hard to do sometimes because of finances and childcare issues, but that is what needs to be done to prevent spreading disease. There is light at the end of the tunnel. Spring will soon be here. We will be spending more time outside as it warms up and the viral illnesses will wane. For people who suffer from seasonal allergies, start taking an antihistamine daily because seasonal allergies will start in earnest as the vegetation wakes up and starts blooming. Wipe down your pets when you bring them indoors. Change your clothing and show to wash the pollen off. As much as I would recommend opening windows to air out the house, also be aware that the fresh air will also bring in pollen. Open the windows after it has rained and cleared the air, and keep them closed otherwise. Use an air filter to help purify the air. As always, I wish you all good health. References: viral URIs, causes, symptoms, and more. Types of viral upper respiratory infections, prevention, symptoms, and treatment. US News. Adult with a viral illness, Gateshead Health. Respiratory Illnesses, CDC.